All right. Good morning, everybody, and welcome to the Medicare Made Simple webinar today. My name is Rekka Ravenborg. I am the marketing manager of Ennis, Pellum Associates, and I'm delighted to have Cathy O'Brien with us today. Cathy from Chapter. I'll do introductions in just a moment, and also Ron Pellum, our president of Ennis, Pellum Associates. Before we get started today, I just wanted to run over a couple of housekeeping items. We are recording today's webinar, and just to make the experience and the sound easy for everybody, we have muted everybody. If you do have technical challenges during the webinar, feel free to submit any questions on the chat. Or you can also email me if you're having problems accessing the chat. You can email me at my email address here, rravenborg@jackscpa.com. As you can see, I'm having some technical difficulties because the presentation keeps jumping forward. Hopefully I'll get that resolved in just a moment. Bear with me. We will strive to answer all your questions today. Cathy is an expert on Medicare, has been doing this for decades, has helped thousands of people. You can submit your questions through the Q&A section. If you hover over your control panels in Zoom, you should be good to submit questions in that Q&A section. Bear with me, I will get this resolved in just a moment. If you prefer that you answer questions anonymously, there is a selection box to just be anonymous, meaning your name will not be displayed, but the question will still be visible to everybody in the webinar. You can also upvote questions. If there's a particular question that's very relevant to you, then please feel free to use the thumbs up to upvote that. So yes, today on the call, Cathy O'Brien is with us today from Chapter. Thank you so much, Cathy, for offering to give us this webinar to our clients and to the friends of the firm. Cathy has been deep in Medicare since 2009 and has advised thousands of Americans on how to navigate Medicare. And also joined today is our president of Ennis, Pellum Associates, Ron Pellum. Ron, you've been with the firm since 1980, and you recently went through the journey of figuring out Medicare for yourself and wanted to offer Cathy and her organization's advice to our own clients, which is why we're here today. So Ron will be helping to share his own journey, and Cathy will present all of, or at least a section of your knowledge, Cathy. So without further ado, Cathy, let's give the control to you. And yeah, please get started.
Here we go. Hey, thank you so much, Rekka and Ron. Thank you so much for inviting me today. It is truly a pleasure. I love Jacksonville, lived there for 20 years and only moved away because of my opportunity to broaden my Medicare megaphone, if you will, by joining Chapter and being able to address people across the entire country. So with that, thank you so much for inviting me. It's a pleasure. So a couple of ground rules for today. Just want to mention that today is purely educational. I absolutely can answer specific personal questions about anything that it pertains to protected information, your date of birth, your zip code, all of that stuff. So we can do that on a one-on-one, but today is absolutely purely educational. Just needed to make sure that we were on the same page here. So the goal today, and I know Ron and I spoke earlier this morning, as well as guiding him through his actual journey. My partner and I, Ari, helped Ron, but today we're going to talk about really just the rules and the regulations, the caveats, exceptions, penalties, all of that good stuff in the Medicare world. And with that, we're going to be able to address people who are just approaching Medicare age, people who are also deeply in Medicare, even people who are just simply helping their parents or family or friends or loved ones through Medicare. So I wanted to make sure that everybody knows that there's a little something for everyone. Ron, anything to mention at this point?
Yeah, thank you, Cathy. You know, unfortunately, a lot of times if you have CPA behind your name and it has anything to do with numbers, everyone thinks that you should know all of that yourself. my crude example is I know how to mow my own lawn. I've mowed my own lawn for years and years on the lawnmower. Now I'm glad to say today I don't own any weed eaters. I don't own any lawnmowers. I tell my tennis buddies it's a great feeling to be on the tennis court playing tennis when I see the lawn crew come up and mowing my lawn. So when it came to needing some assistance, you think that the income tax law is convoluted. For me, that's where I work every day is on the income tax side of life and business. I just didn't have the energy, just like I don't mow my own lawn. I just didn't have the energy to go and do all the research and search all the internet and get all the same. So I think before that I had reached my age 65, and I know that you're surprised that I'm 65. I'm surprised that I'm at age 65.
How does it happen?
But and my wife is close to my age, so we actually had a little bit of a challenge to fill the gap. What are the options of me getting off the firm health insurance program? And I've been a big HSA believer for years and years, and HSA health savings account was a great decision for us. But I had to learn all of these new rules about you can't have an HSA and have Medicare, and when do you have to apply the. But Cathy and her group, I'm not sure, Cathy, I think maybe another client recommended you to the firm. You did a lunch and learn for our firm. I was unfortunately had to miss that, but had the email PowerPoint slides. And it's incredible, 2 or 3 clients reached out with the same questions. And I said, I don't know, I'm learning Medicare myself. I'm just going to forward you Cathy's PowerPoint, which I set on my iPad and read and found it very, very informative. But the big surprise was if you don't apply on time, even if you don't sign up for Medicare, is that lifetime penalty of paying an additional premium cost because you failed to timely make that application. So that window comes and goes. So that at that point in time, I went to my calendar and I put 3 months before my month of birth and said, you got to get enrolled. And then at that point in time, I reached out, and I loved hand holding, and they held my hand through the whole process. The question of what we needed and when we needed, I think you did, and I did that on a cell phone call when I was driving around town. It was completely full circle, and was much appreciated. So that's kind of how we got, because it was meeting my own personal needs and coming up soon to meet my wife's.
Well, what a great narrative. Thank you.
Sure.
I do want to add that there is never a cost for our service to anyone that we speak to. So that's just one additional piece. So anybody who ever wants to reach out, and we'll be posting my my team advisory phone number as well as mine, as well as my email address. And right here on the screen right now is our website. But you can reach out to any of us, and there is never a charge, whether you're looking for an answer to a question, whether you're working with us, or if we're renewing. So just know that that is always free.
And one note, Cathy, we don't get any commissions or kickbacks from chapter or anyone. We just like bringing a good solution to our clients, and we don't get anything for this, just other than she helped a couple of other clients who really appreciated us aligning them, because they call us for the answers, and we say we have the answers in a lot of other areas, but we don't have it in this area of Medicare, and this is who you need to talk to.
Medicare is such a select and very specialized area. I always say I've got terrific job security.
Just like the IRS code is for us and our CPAs.
Exactly. Right. So I do want to mention, and there's a couple of things I forget routinely to mention, and I've got Rekha queued up on one of them, but one of the things I do want to mention, I don't know how many people are on with us today, but we do have advisors that are multilingual. So we've got Spanish, Hindi, Pakistani, and we have just made an offer to a gentleman who is fluent. Actually, his first language is Mandarin. So we are trying to broaden our scope of how many people we can effectively communicate with. America is a melting pot. So English is not the only language that we can speak in.
Yeah, and just to add to that, Cathy, if anybody is unsure whether they're Medicare eligible or not, is that something they can get from the Social Security statement that's issued once a year?
No. You
Not
would
at all?
No, not at all. You know, it's funny. And I'm going to go a little out of order just because this is such a nice conversation we've got going. No, so we have to pay our FICA taxes every year, right? Year in and year out, right? Very few people actually know what your FICA taxes are funding. So it's Social Security and Medicare. And you would think that if we have to pay, we're required to pay those FICA taxes, that somehow information would come back to us once we became Medicare eligible, but it doesn't. And my sister and I learned the hard way, you have to seek out that information. We actually got involved in Medicare because my mom was found unconscious in her home. And we had to learn this Medicare thing by trial and error. That was back in 2005. And by the time she had passed in 2007, we were more than frustrated. We had done it wrong, or we didn't maximize her benefits just because we didn't know how at the beginning. And I so wish that the past me knew my present me, because we could have done this so much better. But you would think that somehow, somewhere, we would, as Americans, get information, unbiased information, true information. But no, actually, in this world of too much information on the internet, we don't know what, I don't know. I don't think anybody knows how to vet what's really true or untrue. So you really do have to start seeking your information, and it's confusing.
Yes. Yeah, it's along the same lines of Social Security. Once you get to the point of collecting on your Social Security, very quickly, I said in a webinar about 7 or 8 years ago by a group, and they met here at Epping Forest, gave a presentation, very informative, about an hour and a half to 2 hours. And the gentleman said that he gave that same session in South Florida, and in the audience was an advisor with the Social Security Administration who had been giving taxpayers advice for 30 years. She went up to the presenter and said, I have never heard before some of the things, half of what you said in that seminar. And she was giving advice to taxpayers, which is, again, sad, but it unfortunately is true. If we're looking to the government to give us the right, maybe they haven't been properly trained with all the specialties and the nuances as the private industry has.
Well, so to speak to that just real briefly, and we haven't even gotten into the meat of the conversation, but to speak to that, the government's answer is the Medicare and You book. It used to be mailed out to anyone who was coming up on the age of 65. And then we all tried to cut back on our paper usage, right? And then it was by request only. Well, you had to know that there was a book to request it, number one. And then 2 years ago, all of a sudden, you can't get a hard copy easily at all, even if you request one, and everything is available online. Well, that's how I learned Medicare when my mom was sick. I tell you, I had Post-it notes, I had highlighters, I had dog-eared pages, I had phone calls going. I was studying deeply, trying to figure out, how are we going to do this? What was the right way to go? What did we qualify for? What did we not qualify? It's hard. It's just plain hard. So with that, let's jump into just a little bit. Let's go back just one, if you don't mind, Rebecca. So I do want to just mention just one simple thing. I'm very proud of it. The National Council on Aging, who has been around for over 65 years, they were part of the initial push to have Medicare passed into law, and they have actually partnered with us. They have given us the stamp of Standard of Excellence. We are one of 2 Medicare agencies nationwide that has met their ethics of unbiased, true, and fair advisory. So I just want to do a selfless, self-serving little ad there. I'm very proud to be associated with the National Council on Aging. We also partner, and I wasn't going to mention this, but I will because you mentioned Social Security. We also partner with the Registered Social Security Analysts of America, and they are the folks that actually teach the people who do those seminars that you were talking about. So we do have another connection, and if you ever need information, I can certainly connect you there. So let's go ahead and jump into this information. This is what most people think of when they think of Medicare, you know, the mere mention of the word. And that's because this Medicare system was passed 57 years ago. It has survived 11 presidencies. And what president or administration doesn't want to put their fingerprints all over something, right? So with that, we've got different rules and different regulations, and oh, we've got a great idea. Let's make the system better by adding this. Well, it's created just caveats and exceptions and penalties. And so that's what makes this Medicare thing look like a maze. But if you approach it like we're going to today, very systematically, very simplistically to start with, then we can go ahead and move on and just figure out, okay, if we look step by step, this does become pretty simple. But it's nice to have somebody in your pocket like myself or one of my advisors to say, oh, wait, there's an exception, or oh, wait, there's a caveat here, or we can take advantage of something else. So let's move forward. So with that, today we're going to talk about just the basic general rules of Medicare. What is it? Who qualifies? I think it's as important to know what Medicare is as to what it is not, because what it is not is actually what drives this conversation. It's pretty simple. We're going to break it down into 3 simple steps. And at the very end of today, my hope, the objective is that everyone that is listening, everybody that is going to share this information with anybody in their circle of influence, is going to understand that you have choices. You have many choices. And to be able to drill down to the specific choice that's best for you is very personal. So with that, let's get moving. Okay. So Ron, jump in here at any point in time, okay?
Hey, I will.
Perfect. So the simple question, what is Medicare? Well, it is the health insurance system that was created by our government for anyone who is age 65 or older and their spouse. If in fact you share a household, a tax return, and you qualify based on your work record, your spouse can qualify as well. So there are 2 other qualifiers, and this is part of the evolution of Medicare, that any individual who doesn't have to be 65 years old, but has been on disability for 24 months or more, month 25, you are now eligible and automatically enrolled in Medicare. Also, those people who are instantly diagnosed with Lou Gehrig's disease, ALS, or with end-stage renal disease. Let's go ahead and move forward.
Oh, there you go.
So simple red, white, and blue card, your Medicare card. 2018, the actual Medicare care card number was changed from your Social Security card to this random collection of numbers and letters, which is very easy to protect because it's not that Social Security number that if somebody gets that or sees it on some record that you have, they can now grab your Medicare number. And if in fact a scam were to come across and they got your Medicare number, those people or those scammers can actually use your Medicare number with your effective dates, A and B, and they can receive your claim your Medicare benefits and be paid for them. So I want to just put a red flag out there to protect your Medicare number as much as you protect your Social Security number. So where do you enroll in Medicare? You enroll at ssa.gov, and that is the Social Security Administration.gov. You have to go through a couple of clicks to get there. So if you want to make it easy, shoot me an email, a text, or our advisory team a text or email. We can send you a link, the actual enrollment link, whether it's you're signing up or enrolling in Medicare Part A or Medicare Part A and B. And bonus, we'll send you some cliff notes on how to get through that system very easily and very quickly.
And Cathy, by the way, again, I like easy, and I didn't want to have to navigate where on that website to go to. And so your staff were outstanding to send me everything I need to click and go.
Thank you. Thank you so much. So I'm sure, Ron, you will echo that you do have to, some people are surprised when you get into that Medicare application, you do have to set up, if you haven't already, an My Social Security portal with the government. And that's really the hardest part of the application because there's millions of us in the Medicare system. So coming up with a unique username, something that nobody else has, is really the most challenging part of enrolling in the Medicare system. Yeah. I always tell people, think of a username that's unique, but not so unique that you can't remember it. Mm-hmm. Write it down. So let's jump into what is Original Medicare. What are the components? So Original Medicare is made up of two pieces, Medicare Part A and Medicare Part B. To be fully enrolled, you're enrolled in both pieces. However, just enrolling in Medicare Part A is kind of like putting your toe into the water. And I'm only saying that because, Ron, you mentioned that HSA component, and we're going to get into that much more deeply a little later in the conversation. But I do want to mention that if you enroll in Medicare Part A only, you are considered part of the system. You just simply don't have the complete picture of A and B. So the complete picture, Original Medicare, is comprised of both pieces. Medicare Part A, what is that? It's your hospital insurance, that's the easy term, or if you're looking at a more medical term, it's your inpatient coverage. It covers anything that where you're admitted as a patient, whether it's a regular hospital, mental health facility, any kind of skilled nursing facility, home health care, and hospice. So Medicare Part A will help pay for the cost of your services in any of those scenarios. Now, Medicare Part A is typically fully prepaid. And I mentioned earlier your work record. So if in fact you have worked for 10 years, or Medicare, the Social Security Department looks at it as 40 quarters equals 10 years, then, and you have contributed to those FICA taxes for that entire time, then your Medicare Part A, and if a spouse or a dependent is qualifying on Medicare with you, this portion of your insurance, the premium, is fully taken care of. If in fact you have not worked for 40 quarter hours or those 10 years, you can still qualify for Medicare Part A, and it's on a tiered system. If you have worked this many hours, then your Medicare Part A premium will be such and such. If it's a little bit less, then your premium will be a little bit more. But typically speaking, most of us have fully prepaid that premium. So on to Medicare Part B. Simple terms, it's your medical insurance. And in medical terms, it's your outpatient coverage. So that includes anything like your primary care physician, any kind of specialists, any kind of MRIs, CAT scans. Let me turn off those little notifications so we don't hear that buzz each time that I'm talking. Sorry about that. Medicare Part B also covers any of those preventative services. So your annual physical. I do want to say your annual physical under the Medicare system is comprised of a few different items than an annual physical prior to being in the Medicare system. And that's simply because these bodies that we were given, they're not made for the long haul. So after age 65, there are a few different sorts of services that are more beneficial to someone who is 65 or older than people who are under 65. Therefore, the difference in the services. You also get your flu shots, any kind of pneumonia shot as part of Medicare Part B at no cost. Any kind of screening for cancer, mammograms, prostate exams, that sort of thing. They're all free of charge, $0 copay, I should say. One little caveat is a lot of people, and I get a lot of questions, this is why I'm calling it out, think that a shingles vaccine would be part of this preventative service, and it is not. Shingles vaccine is part of your prescription coverage, and we'll go deeper into that later on in the presentation. However, I just wanted to shout that one little pro tip out. Shingles vaccination comes under a different category, not Medicare Part B. Now, Medicare Part B's premium for the standard group of Americans, which is about 85% of us, is $170.10 per month in 2022. I've been doing this a long time. I've seen that number go up. I've actually seen that number go down. Unbelievable. I've seen it stay stagnant for several years. So it's unpredictable, but typically, if I were to lump it into a typical number, it usually goes up maybe $5, $6, $7 per year. Now, that $170.10 I have out here in quotations, it is the standard premium. I do need to add that the Medicare Part B premium is means tested, which means that it is based upon your income. So if in fact you earn more than the typical American, your modified adjusted gross income is more than the typical American, then you may be subject to what they call an IRMA. And it's not the hurricane, it's an income related monthly adjustment amount. And very simplistically, we do have a chart, and Rek is going to share that a little bit later. So if you're wondering, oh gosh, am I going to be in that category with a little bit of an upcharge? We'll be able to guide you on that. You'll be able to see in black and white if you file your taxes under a single, or if you are filing under married, or if you're filing married but separately. We've got all of that worked out. You'll be able to just follow the line straight across the chart and understand what your Medicare Part B premium will be.
And Cathy, quickly, is that something that gets issued once a year, just like our tax rates and like any like annual adjustments get adjusted every year? Like, is that revised yearly, or is it just revised whenever it's notified that now there's a revision?
That is a great question. So the first revision in my career that happened was 2 years ago. So that chart stayed the same for 10 years. And I actually know that it was the same for 3 years prior to me even being in this crazy Medicare business. So it has been recently revised. I don't anticipate it being revised for another few years. And the numbers were adjusted ever so slightly. And believe it or not, they were adjusted in a way that is advantageous to us as Americans.
Nice.
How often can you say that, right? Especially in these times of inflation. Crazy. I do want to reemphasize that Medicare Part A and Part B, they only help to cover your inpatient and outpatient services. And we'll go into where that break is in copays and who's responsible for what in just a second. But just in case anybody who's listening is still working, and you can be enrolled in Medicare Part A and still be working and not be enrolled in Medicare Part B. Caveat, it's not typically in your best interest to go that route, but it is sometimes in your best interest. It depends on how much your employer insurance premium is and what the coverage looks like. And here at Medicare, one of my specialties and my team's specialties is to compare the two. What are your options in Medicare? What are the options that you have currently? Let's look at the two side by side, apples to apples. Numbers tell the truth. We'll look and see what is in your best interest. I've been known to say, hey, don't enroll in Medicare quite yet, because what you've got at work is a pretty good gig. In fact, it's better for your pocketbook and your benefits. And here's the timeline as to when one of those things changes, or just check in with me whenever you have a renewal at work with your coverage, and we'll do this comparison all over again. So I've had several people. In fact, one of your guys' referrals, Ron, one of your clients came to us, and I was the first one to say, no, don't pull the trigger yet. Yes, you're eligible to, but you don't have to because you've got employer coverage. You've got all your bases covered. Let's check in a year. And they said, oh my gosh, you're kidding? You're telling us you don't want to do business right now? I said, no, I'm not telling you I don't want to do business. I'm telling you it's not in your best interest to pull the trigger yet. So let's stay in touch.
And Cathy, there's a question here on this subject too. As James has asked, are you means tested every year, or is it calculated once and you're stuck with that?
No, what a great question. No, you are actually, there is a 2-year look back every single year. And what I mean by that is the Social Security Department, the Internal Revenue Service, and CMS, the Center for Medicare and Medicaid Services, they get to share information because they're all government entities. So there's no HIPAA involved. And so Social Security and CMS, they look back at your tax return from 2 years previous to see what your modified adjusted gross income was. And that is what your current Medicare Part B premium will be based on. So with that, what happens when you retire? What happens if you had a windfall 1 year that happened to be 2 years ago, but that income is not true for today? Well, there's a form for everything. Let us know. It's called an SSA 44 form, and we can help you walk through filling that form out. In fact, Ron's firm would be better at helping you walk through that form because it's based on your tax return and what you predict or what you can forecast your income to be this year, and file that form with the CMS and the Social Security Department. And they will say, oh yeah, we won't charge you the premium that we would have charged you from 2 years ago. Tax return will charge you based on what you're claiming your forecast is for this year. They're never going to deny saying, okay, because, so there's always a because, right? Because when tax time comes around, those numbers are going to have to jive. And if in fact your forecast was too much or too little, and it threw you into a different category of how much you should have paid, you will either get a credit or you'll have to pay at tax time to bring yourself current. Now you can file that form as many times as is appropriate. Most of us come to a place where your income is going to be pretty even year in and year out, but know that you've got options. Great question. So let's move on to our next, talking about what Medicare is what we just did. And this is what Medicare is not. Now, the first one is big enough a deal for me to want to shout out, but the second one is where I want to speak in highlighter, if you will. So Medicare does not cover anything related to long-term care. So in the Medicare world, if in fact you are in a skilled nursing facility for 100 continuous days, underline that word continuous, then you've got Medicare helping you pay for your services and your stay. But upon day 101, believe you me, they're counting the days. Day 101, the skilled nursing facility is required to change your label. And I hate to say it in such a cold term, but it is what it is. They are required to change your label from a skilled nursing patient to a long-term care patient. At that point in time, you are 100% responsible for all costs for your care. So there are ways to wiggle through that, if you will. If you, and my sister and I did this several times, if you're still in a skilled nursing facility, say 90 days in, seriously, there's something still going on. Hopefully you've got a pretty good relationship with your physician, and speak to your physician. Is there some way legally and medically necessary to be able to transfer your mom back into the hospital? At that point, you're breaking that continuous days of being in the skilled nursing facility. If you're back in the hospital for 3 days or 4 nights, whether you're counting days or nights, but that's the requirement, then you can be transferred back to a skilled nursing facility. A bed might not be available at the place you just came from. We ran into that hiccup as well. But the bigger point is the clock is reset. And now you're working with another 100 days. And hopefully within that next 100 days, you're figuring out how to either get better, get back to the hospital, go home. But there is a way to get through all of that mess. Now, fewer of us than I wish actually have long-term care insurance. If you do have long-term care insurance, this is the place where you would trigger it. Now, prior to me joining Chapter, I wore a whole bunch of hats, and I also did a lot of counseling and writing of long-term care policies. And I'm happy to offline do some speaking about whether your long-term care policy parameters are written today when you're becoming Medicare eligible to be able to mesh perfectly with the Medicare system. It's a very easy, simple conversation, but let's have that offline if anybody has that question. So here's the bigger question, the bigger part of what Medicare is not. It does not have any maximum out-of-pocket limit. Now, every single insurance policy that is not related to Medicare, under 65, individual, group policy, every other American health insurance policy has to have a financial limit. And it's called your maximum out-of-pocket limit or your annual maximum. Medicare is a financial, and I'm saying it as nicely as I can, a financial black hole. There is no bottom. So when you have Medicare Part A and Part B in place, if you don't have anything layered on top of it, which is where we're going to go from here, but if you don't have anything layered on top of it, then Medicare pays up to 80% of your financial or your medical services, and you pay up anywhere between 20 and 35% of your medical services costs. Now, I know that math doesn't work. I can see Ron's eyes crossing. 80% plus 20% equals 100%. But in the Medicare system, there's this little thing that's called the excess charge. And it says a physician or facility can legally accept Medicare as health insurance, but they don't have to accept Medicare assignment as full payment. Medicare assignment is that crazy Medicare insurance-y kind of word that says the amount of money that Medicare is willing to pay for any given service. So if Medicare is willing to pay this much and the physician or facility is not willing to accept that as full payment, they can charge an extra 15%. Who's going to pay that 15%? That would be you. So in the case of in your backyard, my former backyard, Mayo Clinic, and actually wildly, I have another Mayo Clinic here in my new backyard. Mayo Clinic charges every single cent of that excess charge. So their 100% is the 80% that Medicare pays plus 35%. So no, those numbers don't jive, but we have solutions on how to plug those holes, limit those costs, and maximize your coverage as well as reduce your cost. So with that, let's go on to the very 3 simple decision steps that we've broken this down to. And it really is as simple as this. We're going to talk about how, when, or if to enroll in traditional Medicare, when to consider additional coverage and why, and then selecting a very specific plan. So let's jump into how to decide if and when to enroll into Medicare. Go on into the next slide, if you don't mind. Here you go. So it's really very simple. And Ron, you gave me a perfect segue that 3 months prior to the month that you turn 65 is when you need to start putting your radar up and say, okay, I'm in the window. So this window is actually called your initial enrollment period. And yes, this whole Medicare system and Social Security system, they are in love with acronyms. So this is your IEP, your initial enrollment period. So that period is a 7-month window. It starts 90 days prior to the first of the month of your 65th birthday, and it ends 90 days after the last of the month of your 65th birthday. Took me a long time to be able to say that very easily. So it is a 7-month window. There is a caveat here. So if your birthday falls on the first of the month, then move that entire timetable up 1 month. So if your birthday is on June 1st, you are eligible to enroll in the Medicare system as early as February 1st. And then the last of your eligibility to enroll in your initial enrollment period, and that AKA means no penalty, then it would be the end of August. Now, all of that switches to where the most of us are. Most of us, and I haven't even looked, I can Google it. How many of us have a birthday on the first of the month? I don't know. But if your birthday is on the 2nd of the month or anywhere after, then you're looking at, and I have an example here, June 2nd, you would look at March 1st being your first eligibility to enroll in Medicare system, and September 30th being the last moment to be able to enroll in the Medicare system without penalty. So with that, most of us will enroll via our initial enrollment period. However, if we go on to the next slide, we do have one other opportunity, which is a beautiful opportunity. So if you're still working and you're turning 65, and how many ands can I have in one sentence? I think it's called a run-on sentence. And your employer has more than 20 employees, then you're eligible for a special enrollment period. Now, this is a beautiful thing, because if in fact you're working, you have the option of your employer coverage. And I alluded to this earlier, but you also have the option upon turning 65, or if you're 66 or 67 or 68 or 69, my oldest person that I have actually enrolled into the Medicare system, because he was just leaving employment and it was in his best interest at that point in time to go ahead and enroll in the Medicare system. His better plan was to stay on employer coverage, but he was 82. Believe it or not, a lot of us just like what we do and we continue working. It gives you value, gives you self-fulfillment. So if in fact you're working, you are enrolled in employer coverage, then if you retire or lose your coverage, you have, you've got officially an 8-month window to enroll in Medicare without penalty. However, this is one of those crazy things that don't mesh together in the Medicare system. And somebody should have thought this through a little bit better. You only have 60 days to enroll in a drug plan to avoid penalties. So you can't enroll in a drug plan without being enrolled in Medicare. So those two things don't exactly jive, but these are the official timeframes. My best advice, and the reason that I speak to people, to employees, I go into large employers and speak to all their employees. I talk to unions, I talk to HR departments, I speak to employee benefits specialists. That's because if in fact we can talk to you before you retire, we can make this entire transition absolutely stress-free, seamless, and maximize your benefits from every four corner. So you do have an 8-month window, just to recap, to enroll in Medicare legally, to not be penalized, but you only have a 60-day window to enroll in a drug plan, which means you have to be enrolled in Medicare to avoid a penalty. We want to make this seamless, do it earlier the better. One last quick note, and I am trying to be very cognitive of time. I know we've got about 15 minutes left. If in fact your employer has less than 20 employees, then you need to enroll in Medicare upon your initial enrollment period, turning 65, because your group plan is no longer your primary payor, that's insurancees. They're no longer going to pay first, nor will you be able to absolutely claim in your group coverage. Your group plan can terminate, can change the rules at any point in time, and then you're left holding the bag. So if in fact your employer has less than 20 employees, I advise you highly to talk to somebody about enrolling in the Medicare system before you turn 65. So let's move forward. And Ron, I'd love for you to have a moment in this conversation. It's all about HSAs. So I have a whole lot of writing here, and I don't want to be speaking about every little detail that I've written down, but I know that we're going to send this out, and I wanted people to have information at hand to be able to refer back to. But there's a whole lot of HSA back and forth confusion upon the Medicare enrollment. So Ron, maybe you want to say a couple moments, and then I'm happy to pull in the tail.
Yes, and I know that time is very sensitive, and that's why you're better off to hear from Cathy than from me. So I'm going to try to be brief. On the question back on the previous slide, you don't need to go there on employees. I think because we had more than 20 employees, it did not matter if those employees were taking health care or not, did it?
Correct.
It's basically employee count, regardless if they are in the plan or not in the plan, because relatively few of our employees do have health care through the firm. They often have it with their spouses or other arrangements. So I wanted to clarify that on the employee account. I love my HSA. I've said that no one should ever brag that health insurance was the best thing they ever bought, because that means you spent your life with doctors and in the hospital. What you really want to say from a pragmatic perspective is I bought health insurance and I never had to use it. It's the worst thing that I ever bought. Good for you. You lived your whole life without doctors and hospitals, very healthy. That being said, the best thing I ever did was an HSA. I was disappointed because I continued to fund my HSA, and from a tax perspective, didn't even pay for my medical bills out of my HSA because I wanted my HSA to continue to grow tax-free. And so I pay with my post-tax money. So just another tax planning perspective. So when I became, when I enrolled February 1, then my HSA had to stop. And pretty much that's all that I'm going to say about it.
Good. You knew all the rules to follow. So there is a couple of things. The most common question that we get is, oh gosh, I've already prepaid my entire contribution for this year, but it's July and I'm now enrolling in Medicare and I know that I'm going to be penalized. How does that work? Well, yes, you are going to be penalized if in fact you can't back those monies out. You can only contribute to an HSA for those months that you were not eligible for Medicare. So if you know that you're going to be enrolling in Medicare this year, and maybe it's, the 8th month of the year, you can contribute for 8 months. So you take the total amount that you can contribute, multiply or divide it by 12, and know how much you can contribute on a monthly basis, and contribute however many months is legal up to your 65th birthday or whenever you're going to enroll in Medicare. So if you are working and you haven't enrolled in Medicare and you're 67, but now all of a sudden it makes sense to enroll in Medicare, you could have contributed as long as you were not enrolled in Medicare Part A or A and B. But at the beginning, I talked about one toe in the water. A lot of people who are working will enroll in Medicare Part A, keep their employer coverage because there's no premium for A. Then you've got a secondary hospital coverage. But at that point in time of enrolling in Medicare Part A, you have now disqualified yourself from contributing to an HSA. If in fact you have contributed, you will at tax time then have to pay the income tax on the monies that, and I think Ron can echo that, you're going to have to pay the monies, the income tax monies due, but you're also going to be penalized with an excise tax. And if I'm correct in my figures, that excise tax is an additional 6%. So just know that there's some ins and outs. I'm happy to have that offline conversation to go into a lot of different detail, because there's a lot of different avenues. So let's go ahead and put the HSA conversation on the table, knowing that I'm happy to open that can of worms up with anyone. And let's move into considering additional coverage. If you can roll to the next. So the reason why people consider additional coverage is the first and foremost, where I said, what is Medicare? What is not Medicare? It's a black hole. So if you only have Medicare, then you are responsible for 20 to 35% of your cost of services with no end in sight. So just as a small example, no complications at all, hip replacement range anywhere nationally from $30,000 to $112,000. Now, some states have a lower cost of living, some obviously a higher. That's where that big range comes. If you do the math, you're going to be responsible, if you only have Medicare as your health insurance, anywhere from $6,000 to $22,000+. That is for a very simple, no complicated, very common surgery that happens these days. So let's do away with all of that tax income burden or cost burden, and let's look at how can you add to your Medicare coverage to make this more financially doable. One other note is most of us on employer coverage, we're used to having prescription coverage, dental coverage, vision coverage. That stuff doesn't come with Medicare, but we can incorporate it in some kinds of the Medicare world. So let's move on to the next piece of information. Okay, so once you have Medicare Part A and Part B, let's backfill all of that financial responsibility, and we can do it one of two ways. There are really two simple ways, two different options to layer on top or to trade Medicare to not only reduce your cost, but increase your benefits. And I'm going to go into detail in just a second. But the first way is to say, okay, I've got Medicare Part A and Part B, which you need both of them to qualify for a Medicare supplement. Sometimes these are called a Medigap plan, but you'll also need a standalone prescription plan. We'll talk in more detail in a second. The other option is to enroll into a Medicare Advantage plan. You need to enroll in Medicare Part A and Part B, and essentially you're trading your Medicare government insurance for a private insurance carrier company, a United Healthcare, a Humana, an Aetna, a Cigna, the list goes on, for a PPO or HMO type plan. It's a bundled plan, and you get not only the benefits of Medicare Part A and Part B, but you do get some of those additional dental, vision, hearing, and most of the time in the Advantage plan, you also get drug coverage. So let's go into some detail into what that supplement is. So you do have Medicare Part A and Part B, and a Medicare supplement is not technically a health insurance plan. It's technically a financial plan. So you've got Medicare as your health insurance, and you layer on top a supplement. Now, there is a monthly premium for that supplement. And so some people say, well, why would I want to pay even more out of pocket each month? Well, here are the pros of being able and cons of being able to get a supplement. Yes, you do pay an additional premium, but it minimizes or removes any out-of-pocket costs associated with Medicare Part A and Part B. The most popular Medicare supplement plan, there are 10 different ones, and it can be confusing because they've been labeled with letters as well. So you've got A, B, C, D, G, F. It gets a little jumbly, but the most popular Medicare supplement plan today is a supplement plan G. So I'm going to kind of speak to that because shoot, 95% of the supplement plans sold are plan G. And the supplement ends up giving you the maximum flexibility. You have no network. You don't have to look up on a list of what physician can I see or what facility can I go to? What's in network? You have no network. The only thing you need to be cognitive of is, does that physician or facility accept Medicare? We are an aging society. Most physicians and facilities accept Medicare. So if they accept Medicare, then they accept your supplement. This particular type of plan also gives you foreign travel coverage. So if you're traveling overseas, your health insurance goes with you, which is very unique in the health insurance world. If you're not in a Medicare plan, to get foreign travel coverage, you're typically purchasing an additional plan. This supplement typically comes with foreign travel coverage. So the plans, I said there were 10 of them, and they've got all these letters to name what they are. The benefits of each of those plans, let's just take Plan G, for instance. The benefits of Plan G are standardized by the government. So it doesn't matter if you get it from Mutual of Omaha, Transamerica, United Healthcare, Humana, Aetna. All of the benefits are standardized and are the same. However, speaking in highlighter, the premium that each of those companies charges is vastly different. So at the point of shopping for a supplement, which is what we do day in and day out, and we shop every single plan that CMS, that the Center for Medicare and Medicaid Services, has contracted with. We're looking at every single one of them. And that's part of what makes Chapter unique. But we are looking at not only what is the premium today, but the algorithm that we've created in our software will also give you an insight based on their increases in premium in the past, in their history. We've created an algorithm that will forecast the next 5 years, 10 years, 15 years, and 20 years of increases in your premium. So we're not just shopping what your premium might be today. We're trying to take care of you into the future. The other huge benefit within the supplement world is it is a contract. Like I said, it's a financial plan. The benefits that you sign up for today, they don't have an annual change. These are the benefits that you will have as long as you pay that premium. This is what you've got. Nobody can change what you've purchased. No switching around. So you've got guaranteed issue for this particular type of coverage in most states for the first 6 months of being enrolled in Medicare Part B. What do I mean by guaranteed issue? It means you give them your name, rank, serial number, and they say, come on, join the party. After that 6-month period, you're now going to have to give them, the insurance company, your name, rank, serial number, firstborn's name, your drugs, your doctors, your health history, any pre-existing conditions. That's called being underwritten. That insurance company then gets to say, do we want to take on the risk of your health and your health risks? You can be denied. So from the get-go, we shop this particular plan, if this is your choice between the two options, incredibly hard, because this is an essential lifelong choice. You don't want to ever have to be underwritten to get a lesser premium. A lot of times your health changes from year to year, and all of a sudden, yikes, something has come up and you're no longer eligible to be enrolled in a supplement. So any questions on this?
I have to say, Cathy, we are actually at our full hour now, and maybe you can just speak to, we will obviously continue going. Can you speak a little bit to how much longer you think the presentation will take? And before you do, I just want to remind everyone, you will receive a link to the recording. So if you have to jump off now, feel free. We will still share, we'll continue to carry on. Cathy will share her knowledge, and we will send the recording out to everybody so you don't have to miss the end.
Thank you so much for that. If I can have an additional 5 to 7 minutes.
Perfect.
Does that work for you, Ron?
Works for me.
Okay, cool. Let's go on into the next slide and let's talk about a very common question that happens is, and I just addressed this, can you be denied a Medicare supplement? We just covered that, yes, you can, if in fact you have waited past your initial enrollment period, your guaranteed issue. So let's move on to the next slide. So if you have a Medicare supplement, you're going to want to have a drug plan. Now, it only covers drugs, plain and simple. It is not required that you take a Medicare Part D plan, a prescription plan, but it is highly recommended because this is one of those little wiggle places where you can incur a late penalty and a late enrollment penalty if you don't enroll within the first 6 months, the first 60 days of having Medicare Part B. So to not be assessed a late enrollment penalty, we would assist you to enroll in a Part D plan. The way we do that is we want to know what your prescriptions are, the name of your drug, the dosage, the frequency that you take it, and we will take your picture, the snapshot of the prescriptions that you take, and lay them into every single drug plan available in your area. And we'll be able to advise you as to which plan is in your best interest. Maybe a different plan than your spouse, a different plan than your neighbor, because it's based specifically on what you take. So how do you get it? You can get it via a standalone prescription drug plan that goes along with a supplement, or if you choose the other option that we're going to talk about in just 1 second, the Advantage plan, oftentimes a drug plan is included. So let's go into exactly what is a Medicare Part C plan. So this is the other option. It's the bundle option. So Medicare Advantage plan has to, by law, include every benefit that Medicare Part A and Part B includes, but it also has other quote unquote advantages. You have got benefits such as vision, dental, hearing. Sometimes there's an over-the-counter benefit. Oftentimes there's a gym membership that's fully paid for you, but these plans typically have a low premium and most often a zero premium. So it's not free. I want to emphasize that you do have to pay your Medicare Part B premium, and that Part B premium gets funneled through CMS and goes to the private insurance company that you are now contracted to have your insurance through, and that pays your premium. Most of the time, like I said, it has a Part D, a prescription dental component to it, so you no longer have to worry about that. And a Medicare Advantage plan year in and year out is guaranteed issue. You don't have to answer any health questions. One of the drawbacks to a Medicare Advantage plan is that every single year, the network can change. The doctors can be in or out of network. The benefits can change. The copays can change. So there's a little bit of flex that you have to be prepared for if, in fact, you're going into an Advantage plan. So let's go into the next slide. And I'll say this rather quickly, one more. So as we started talking earlier, Ron, story about Shirley incorporates perfectly. I was presenting at the Ponte Vedra Senior Center 10, 15 years ago, and Shirley is about 4'9". She stood up pretty angry after I had gone through all these different options. And she said, I've had Medicare for 4 years. I just had an MRI. I'm now on a payment plan to pay for my MRI. Why didn't Social Security tell me I had all these options? And all I can say is, it's not their job. I hate to say it that way, but that's why this kind of information is so important. So let's go ahead and move on to the next slide. So last but not least, let's talk about how we select the specific plan. So just for an example, it's very difficult for an individual to look at all of your different options and weigh them in a systematic way. Here in Jacksonville, in Duval County, you have 82 different Medicare supplements to choose from, 42 different Medicare Advantage plans to choose from, and 22 drug plans. It becomes a nightmare looking at all of those things, and how do you make your best decision? So we're here to be able to not only advise you based on your specific scenario, your doctors, your lifestyle, your budget, but we'll make this into a very simple journey for you if you can roll into the next slide. So we are going to start with talking about your pocketbook. Your doctors are next, what kind of prescriptions you take, and your lifestyle. Go ahead. And every single year, just like when you're at work, you've got an annual review, you've got a renewal of your plan. Consider annual enrollment period, October 15th to December 7th, year in and year out, to be your moment in the sun to be able to decide, has the plan that I had last year, is it going to serve me best this coming year? We like a no charge, and we look at everything on how your plan has or hasn't changed, how your health has or hasn't changed. We'll do the entire review. You can look at, you pop something into the chat, you can email us for a review, or you can give us a call. I want to highlight the annual enrollment period is October 15th to December 7th. That is your maximum flexibility time frame, every single window, to be able to decide what you want to do. Go ahead and roll that film, as they say. Let's go ahead and go forward correct. Let's go forward. And one more time. So to learn your choices, you can either, let's stop there. We've been in the news a lot. So if you want to vet us, if you want to look into any more information about Chapter, there's a few of the news articles that we've been in, but you can talk with us. There's no obligation for Medicare guidance. I do have a specific Cathy team that works very specifically with HSAs and employers, is very financially sound in all of the caveats, not just simply moving into the Medicare world. The phone number for my team is 602-649-5144. And we really do intend to make this a very simple process. I hope, Ron, you'll attest to, it's a matter of just making a phone call and you will know what your options are. Then the rest is up to you to make the decision. No pressure, no obligation. Go ahead. One more time. One more time. There we go. I hope this has been time that has been well spent. Ron, I'd love for you to just kind of wrap things up. Let me know if there's anything that I've missed or that you'd like to highlight.
Yes. First of all, how can you not love Cathy? She's just delightful to work with. She's passionate. She lived firsthand. I love to hear the personal testimony and what makes people do what they do. It's very obvious she's good at her job. And I'm just sitting here grateful that you came across my life at a time when I was needing to do this, because I would hate to be doing this on my own. So thank you for a wonderful job and a wonderful presentation this morning.
Thank you so much. I know some of this information is kind of dry, it's so numbers driven, but we really do try to make it fun. And it is a very personal journey that each of us would go on. And it is such a pleasure to get to know each and every person. Ron, has been a pleasure to get to know you. David, the gentleman who brought me to you, I have gotten to know his entire family. It's been a huge honor to be in this business, in this helping Americans. So thank you. Thank you so much. And Rebecca, thank you so much for facilitating all of this. Couldn't have done it without you.
And thank you, Cathy.
Going over.
And quickly before we leave, I just wanted to say, obviously, thank you, Cathy. Already I've learned so much and have my own personal follow-up questions. And I know you will stand ready for anybody that wants to reach out directly to you. Either you will answer those questions personally or you'll refer them to another member of your team. I wanted to say, if any of you are in the position where you're maybe helping a parent or someone else navigate Medicare and they're maybe not like savvy online, Cathy has like hard copy packages that she offers to mail out to everybody. Those are really, really helpful. They're the purple binders. So my advice to all of you is just reach out to Cathy. and begin a conversation. If you want to learn more about Medicare and what her team does, I would also advise each of you to ask her, well, how does your team make money? Because that was one of my questions to Cathy, because the service doesn't cost anything. We don't have time to cover it today, but it's a really interesting view of how Cathy's company combines technology, Medicare advice, and then how things eventually come back to them through these plans that people purchase or not. It's a really, really interesting story. And Cathy, I was very inspired by how your company has set themselves up. And how your advisors know or don't know, what money is made on it. That's super interesting and just speaks to the integrity of your company. So everybody, thank you for your time. Sorry we went over. I hope it's been informative. I hope it's, it might spark some further conversation. I know, Cathy, you're standing ready. So we will send out all of the material from today and share also that chart that you spoke about, Irma chart, that talks about some of the monthly premium perspectives. And after this, reach out to any of us, Ron, myself, or Cathy, to continue the conversation.
Thank you.
Okay, Ron, thank you so much.
Okay,
Thank
take
you
care.
all. Bye-bye.
Have a fabulous day.
You
Bye-bye.
too. Bye, everyone.